Thank you, Charlie. Hi, everyone. I'm Leanne West, and I am president of the International Children's Advisory Network. And we are so appreciative to have everybody here today and for all of those who will come later in the week as well. I just want to give you an overview of some of the great things that we've had going on this year. But first, I want to give a shout out to our new chapters. Yay! We had a focus on expanding to the West Coast, and we did. So we welcome Kids Los Angeles, Kids Chalk Rady, and Kids Bay Area, as well as Kids Nebraska, Kids WIT, which stands for Women in Technology here in Georgia, and Kids Canada Francais. So we are super excited to have all of you join the iCAN family. We also want to welcome our new Youth Council chairs, Nadia Ansari, originally with our virtual chapter, but now with Kids Chalk Rady, and Mitali Vidula from Kids Connecticut. I also want to give a shout out to our outgoing chair, Ananya Ganesh. She is now at Stanford, but she did a wonderful job while she was chair of the Youth Council as well. So again, thank you very much. I would also like to welcome new Parent Council Chair, Holly Walker. She is from the Ohio chapter. And I also want to give a thank you to our former Parent Council Chair, Kirsten Sherman-Servati. But Kirsten isn't leaving us. She has agreed to take over our virtual chapter. So we're super excited about that and really appreciative of her time to do that. All right, so what have we been up to this year? We have been working on our next curriculum module of understanding clinical trials, and we are so excited to launch it at this summit. You will also see that we are making the videos available in multiple languages. If you would like to assist with more translations of any of our materials, please let us know. We would definitely welcome your input and your help. We also would like to thank PRA Health Sciences, the Multi-Regional Clinical Trials Center, and the Institute for Advanced Clinical Trials for Children, who all worked together to create this research curriculum. And they did it with some help from some of our chapters too, at Kids Illinois, Kids Michigan, Kids Kansas City, Kids Connecticut, Kids Central Ohio, Kids Albania, Kids Germany, and Kids France. So thank you everyone who participated in making this happen. We also started a monthly series called Ask the Experts, where we get kids to have conversations with clinicians, interns, inventors, anyone in the medical healthcare space, and also our host, Dr. Anthony Chang, who is the Chief Intelligence and Innovation Officer at Children's Hospital of Orange County, and also founder of the International Society for Pediatric Innovation and AIMed. And through these partnerships, our youth have been able to be the kickoff speakers for several of the AIMed series of events, sharing their experiences living with healthcare technologies. We've also shared many surveys to get feedback from our kids, one of which was to create guidance for the pharma industry on best practices in injection development. We've held focus groups in which kids have identified the best marketing materials, thank you items, pre and post clinical research support. We've also had several of our kids star in videos for several of our partnering organizations, and they have given feedback on mobile apps and games through our partnership with KidsX. We also held a special event with Wish Upon a Teen with kids and parents living with and recovering from childhood cancer. We have supported our kids' creativity, where one of our kids from our Bay Area chapter is building a Minecraft world that teaches about what it's like to live with certain conditions. Let me know if you'd like to work with him. We'd be happy to connect you. And we also have a youth member creating a video series on living with chronic pain and other invisible conditions. And again, if you think you would like to be a part of that, just let us know. We'd love to connect you. Our Barcelona chapter held a mobile world hackathon with Boston Children's Hospital. That was very exciting. We also had a fun activity with a group called Beauty Bus and Hope for Henry, where they worked with our kids to see how our kids liked an activity before actually taking it into the hospital. In addition, through our young adult program, we sent a summer intern to the Pediatric Trials Network. And where else can you find us? We're all over, actually, but you can find us in Neonatology News, thanks to Mitch Goldstein, and also the AAP SOAT newsletter, thanks to Chester Coe. We will have a booth at the American Academy of Pediatrics event in October, so please come see us if you're going to be there. It's going to be in Philadelphia, October 8th through 12th. And lastly, we are very excited to be official partner of the FDA. We have sent multiple kids to speak to the FDA again this year and partnered with them to create a new FDA page on our website to make it easier to find the FDA resources for kids and families. For any of you in the audience today, adult or child, thinking all of this sounds really cool or who want to get more involved with iCAN, reach out to Amy or me or your youth council leaders or sign up through our website at icanresearch.org. We would love to have you participate. There are so many opportunities that happen during the course of the year that I think are really just wonderful for kids and families alike. So we are also constantly updating our website with these new opportunities. So check back often for more exciting activities to come before our next conference in Lyon, France. We're also going to have all of our chapters around the world participate in a research activity with global impact that will be reported on when we meet again in Lyon. One last thing I want to say is thank you, a very sincere thank you to all of the really brave and determined kids out there who willingly share their stories to continually help improve pediatric healthcare for all kids everywhere. It is truly my honor to be a part of iCAN because I really can't imagine anything better than watching these kids do what they do and make such a difference in the world. And now I would like to welcome our keynote speaker, Tracy Gray, who is patient engagement lead in the FDA's Center for Devices and Radiological Health. She will be accompanied by her colleagues, Basum Pieris, the Chief Medical Officer for Pediatrics and Special Programs, Annie Saha, the Director of Partnerships to Advance Innovation and Regulatory Science, and Fraser Bosell, a psychometrician and clinical outcome assessment reviewer with the Patient Science and Engagement team. So Tracy, over to you.